really talk about how obesity and childhood obesity affects this region. So to go off the stats, these are probably no surprise from what we've heard earlier today. 39% of children living in Vanerburgh County are obese or overweight. And kind of going off what Charlie said, 80% of those parents believe that their child was at a healthy weight. And these results were self-reported. So even I have to think, even as a dietitian, sometimes I may not know my child's height and weight exactly. So even these numbers may fluctuate a little bit. So Healthy Communities Partnership, again, to go off what Charlie said, we are a coalition, but more so than a coalition. We really want to work together. We try very hard not to compete and drop our name, our logos as we walk in the door. And whenever the Healthy Communities Partnership Board got together and decided what was going to be our goal for that next 3 years, next 5 years, it took a year and a half to decide what our collective goal was going to be. And we landed on to diminish childhood obesity and overweight by 20% by 2020. And let's just say 2020 is sneaking up on us very fast. But we do this as a community, as all of our collective organizations combined. It is not one organization that's fighting this charge. We really have to do it with our members' help as well as our community's help. So here are our partners that are part of HCP. And again, just the backbone role, myself and Casey Williams, if you want to wave, Casey. Both of us serve as the backbone for HCP, and our sole responsibility is to make sure the wheels keep turning on this, which is different than a lot of coalitions, as maybe it's someone's task along with other job responsibilities. So as you can see, there's a host of partners from Evansville and the mostly Evansville area, but we want to grow. This work cannot be done with these partners alone. We want to make sure it's a community effort. So back when we decided on our goal, we thought we need to think of strategies to be able to obtain that goal. So we've developed 3 strategies to be able to reach that 20 by 20% goal. And then we developed work groups out of these goals, or out of these strategies. So we have a policy and setting work groups. This work group charge is to change policies in settings where children are. So this could be schools, after-school sites, churches, anywhere where you think children reside. Next is that access to healthy eating. I can tell someone to eat fruits and vegetables all day long, and they may want to eat fruits and vegetables, but if fruits and vegetables are not affordable and accessible to them, that's not going to be their option. So this group's charge is to make sure that everybody in Evansville has access to affordable and healthy fruits and vegetables and whole wheats and milk, just the diet quality piece of it. And along with that is that access to active living. We want to make sure that our trails and our sidewalks and the whole city is connected so that we have destinations that we can walk or bike to. And lastly is just how do we motivate the community? I have worked in Evansville for 10 years, and how do we really get the community behind healthy eating, active living, specifically with children? So we've worked as those 4 work groups since May 2017, and we've done a few things that we're really proud of because our work is different from the traditional program work. We strive to change policies. We strive to change the systems in which we live, work, and play, as well as the environment. Not only the built environment where you walk, but also the social environment in which we live. So here's just a few. I'm not going to go through all of them, but we are going to highlight a few. So one of the highlights is we did a social awareness campaign about screen time. So as we were talking about policies and settings, we thought before we even approach the policy piece, there needs to be an awareness piece of the screen time children have. So we approached childcare providers through 4C to be able to get our message out. And we also did a social awareness campaign on WFIE, and we'll hope that it plays.
How much time does your child spend in front of a screen? Do the math. The average 5-year-old experiences 7 hours of screen time each day. Too much screen time and not enough physical activity can seriously affect childhood development, including communication skills, obesity, and impulse control. Know the recommended limits on screen time for your child. Ditch the digital and get active. Speak to your doctor or visit healthyevv.com today.
So that PSA was aired in the month of June, and we are able to share it. So if any community partner would like to air it, if they have commercials rotating on TVs in your lobby, we would be happy to share this video with you. Here is the flyer that all 4C providers received, as well as our pediatrician's office at our 2 main hospitals, and Echo Clinic also received some of these flyers of just letting parents know what is recommended amount of screen time. And really, we did not go into the complications of it. It's more of just get active, put down the screen, turn off the TV, move your body. And I'll let Andrea Hayes, she's one of the co-chairs of one of our work groups, talk about another highlight.
Thank you, Lacy. So I am with the Healthy Eating Work Group, and I'm happy to say I'm a proud member of the Healthy Communities Partnership, and I hope you'll join us too if you haven't already. We are really proud of the initiatives that we took on really this past spring to provide more food access to our residents, particularly those residents who are recipients of the SNAP program, which you may know, formerly known as food stamps. So we have worked with both of the markets in both downtown Evansville as well as the market at Franklin Street Bazaar to ensure that if you are a SNAP participant, you can utilize your benefits at the markets, no matter which grower that you're going to purchase the produce from. And we're delighted that the 2 health systems got on board to provide what's called the Double Bucks Incentive Program, which allows our participants to double their value up to $10 of what they purchase with their SNAP benefits. So we're really excited about this. It's already going very well. It started just in June, and we're already seeing those benefits being utilized. Another great example of collaboration is when we were trying to figure out what might be other barriers to get people to utilize the markets. We realized transportation can definitely be a barrier. They're not necessarily located in an area where a lot of our neighborhoods are at. So the YMCA actually stepped up and said, hey, we could try a pilot this summer and provide a shuttle service for your market at the Franklin Street Bazaar on Saturdays. Of course, Saturdays is easier for them because Fridays or the weekdays, they're very busy with their program. And we thought, what a great opportunity to pilot this and see if we provide transportation and people use it, then we can also collect data and explore how we might make some system changes to provide for future markets at both downtown and the Saturday market. So what do we have going on in the future? We're really excited. August 25th will be the painting of what's called one of our first painted play zones, and that's utilizing an open space on a blacktop area in a parking lot, at a school, at a church, at a community center, but it's really providing an opportunity for kids to have active play, but not necessarily spending the big dollars to have play equipment. It really allows them to be creative and active at the same time. So we're really looking forward to launching that initiative. We are exploring how we might be able to provide some technical assistance to schools as well as after-school programs to create more walking school bus opportunities. We're delighted that the EVSC has partnered with us to launch a pilot with their athletic department. We are aware that they are already offering some healthy options at those after-school concessions at sporting events, but we know that there's probably more options that we can also provide. So we're working with the EVSC soccer fields to see if we provide additional options. Will that be an added benefit for those families who are rushing there after work and after school? And that'll launch actually just in a couple weeks from now. Further, we're wanting to make sure that our youth are starting off on the best foot in the morning, and we have become aware that they're not always utilizing and maximizing the breakfast that is offered at the schools in the morning. So we're looking forward to working with the EVSC schools to help them incentivize that and motivate the usage. And finally, what we're really excited about is we're getting ready to look at what is the next level of initiatives. You heard Lacy say we just kind of got started with this new vision and this new goal in spring of 2017. And now that we've had a year to really get these initiatives underway and get our feet wet, we're ready to figure out what's next and how do we take it to the next level. So I would like to invite all of you, if you would like to become involved, or if you know someone who would like to become involved, or there's someone within your organization or agency, to please join us. That will be September 25th, and that is going to be our prioritization process. It'll be from 8 a.m. until 12 at the downtown YMCA here in Evansville. And then finally, we also want you to visit us, join our Facebook page, visit us on the website. There is additional information regarding each of the 4 strategy areas and the different work groups. If you are thinking about, wow, I would like to get engaged with this, please definitely check it out and definitely like us on Facebook. And if you have any questions or you want to meet with myself or with Lacy and Casey, we'd be happy to sit down with you, and their contact information is listed. We'll also be here afterwards if you would like to talk to us individually. So thank you.